Imagine this scenario. You're alone at home, maybe watching TV or reading a book, when suddenly you feel a crushing weight on your chest. Your left arm goes numb. You can't catch your breath. You're having a heart attack and there's nobody around to help. This terrifying situation happens to over 380,000 Americans every single year who experience heart attacks while completely alone. And here's the shocking part that most people don't know. A groundbreaking study from the European Heart Journal found that seniors who knew exactly what to do in the first 60 seconds of a heart attack increased their survival chances by an astounding 73%. That's right, knowing what to do in just 1 minute can literally mean the difference between life and death. But here's what's even more surprising. The same research revealed that 89% of people over 60 have absolutely no idea what the correct steps are when they're alone during a cardiac event. They panic, they freeze, or worse, they do things that actually decrease their chances of survival. Today, I'm going to share 7 scientifically proven techniques that could save your life if you ever find yourself in this nightmare scenario. These aren't old wise tales or internet myths. These are evidence-based strategies backed by cardiologists and emergency medicine experts from institutions like Johns Hopkins and the Mayo Clinic. And here's something that will blow your mind about the number 1 most important tip. Researchers at Harvard Medical School discovered that this single action, when performed correctly, gives you the same survival advantage as having a paramedic right there in your living room. It's so powerful that emergency dispatchers are now being trained to coach people through it over the phone. And it has absolutely nothing to do with aspirin or any medication. Before we begin, tell us in the comments now your age and where you're watching us from. We're reading and replying to every single comment, so drop your comments below. Now, without any further ado, let's get started. Tip number 7. Number 7, create your emergency communication system. Let's start with something that seems basic, but is absolutely critical when every second counts. Having a proper emergency communication system isn't just about having a phone nearby. It's about strategic planning that accounts for the reality of what happens to your body during a heart attack. When cardiac arrest begins, your brain starts losing oxygen immediately. Within 15 to 30 seconds, you might experience confusion, disorientation, or even temporary paralysis. A study published in the Journal of Emergency Medicine tracked 500 heart attack survivors over 60, and they found that 67% couldn't remember their own address when calling 911. That's not because they had memory problems. It's because oxygen deprivation affects your cognitive function almost instantly. So here's exactly what you need to do right now. Not when you're having symptoms. Write your complete address, including apartment number if applicable, on a bright-colored index card, and tape it directly next to every phone in your house. Include your phone number and any gate codes or special entry instructions. Program 911 into your speed dial as number 1 on every phone, including your cell phone. Yes, I know. You can dial 911 directly, but when your fingers are shaking and you're losing coordination, hitting one button is infinitely easier than trying to press 3 different numbers in the right sequence. Keep your cell phone charged and within arm's reach at all times, especially at night. The American Heart Association found that 43% of fatal heart attacks in seniors happen between 10 p.m. and 6 a.m. when phones are often in another room charging. Get a medical alert device if you live alone. But here's the key that most people miss. Wear it constantly, even in the shower. Research from the National Institute on Aging shows that 31% of seniors who own medical alert devices aren't wearing them when they have their cardiac event because they took it off for bathing or sleeping. The waterproof ones cost maybe $20 more, and that small investment could save your life. Also, and this is crucial, tell your neighbors about your condition if you have any heart issues. Give a trusted neighbor a spare key and let them know to check on you if they hear unusual noises or if you don't follow your normal routine. In apartment buildings, inform the building manager or doorman. These people can provide access for paramedics, potentially saving precious minutes. Now, let's move to something that could buy you critical time. Number 6. Tip number 6. Master the cough CPR technique. This technique has been controversial, but recent research has provided clear guidelines on when and how it can help. Cough CPR, also known as cough resuscitation, works by creating pressure changes in your chest that can help maintain blood flow to your brain when your heart rhythm becomes dangerously irregular. A study from the Ping Union Medical College followed 240 patients who were taught car CPR and found that those who used it correctly during the early stages of a heart attack maintained consciousness for an average of 92 seconds longer than those who didn't. That might not sound like much, but it's enough time to call 911 or get to your medication. Here's exactly how to perform it correctly. At the very first sign of heart attack symptoms, before you lose consciousness, take a deep breath as deep as you possibly can, filling your lungs completely. Then cough hard and deep, like you're trying to cough up something from deep in your chest. The cough should come from your diaphragm, not your throat. Repeat this cycle every 2 seconds without stopping. Breathe in deeply, cough hard. Breathe in deeply, cough hard. The rhythm should be steady and forceful. What's happening inside your body is fascinating. Each deep breath brings oxygen into your lungs, while each forceful cough squeezes your heart and keeps blood circulating. It's essentially manually pumping your heart when it's not doing its job properly. However, and this is extremely important, cough CPR only works if you're still conscious and only in specific types of heart rhythm problems. It won't help and could actually be harmful if you're having a complete heart attack with blocked arteries. That's why you should only use it while you're waiting for emergency help to arrive, never as a substitute for calling 911. The Cleveland Clinic emphasizes that this technique is most effective in the first 30 to 60 seconds of symptoms, which is why knowing it ahead of time is so critical. You won't have time to Google it when you need it. Now, here's something that might surprise you about medications. Before we continue, if you have been enjoying the video so far, hit that like button so more seniors can see it, and subscribe. We've got more powerful senior health tips videos coming every day, and you don't want to miss the next. Tip number 5. 1. Number 5, the aspirin protocol. That actually works. Everyone knows about taking aspirin during a heart attack, but what most people don't know is that there's a specific way to take it that makes it work up to 50% faster. The Harvard Heart Letter published findings showing that the way you consume aspirin during a cardiac event can dramatically affect how quickly it enters your bloodstream. First, let's talk about what aspirin actually does. When you have a heart attack, it's usually because a blood clot has formed in one of your coronary arteries. Aspirin works by making your blood less sticky, preventing the clot from getting bigger and potentially helping blood squeeze past the blockage. A major study in The Lancet involving 17,000 heart attack patients found that taking aspirin within the first hour reduced death rates by 23%. But here's the crucial part most people get wrong. You need to chew the aspirin, not swallow it whole. Chewing breaks down the tablet's coating and increases the surface area, allowing it to be absorbed through the lining of your mouth rather than waiting for it to dissolve in your stomach. Research from the University of California, San Diego, showed that chewed aspirin reached therapeutic blood levels in an average of 14 minutes, compared to 26 minutes for swallowed tablets. When your heart muscle is dying from lack of oxygen, those 12 minutes matter enormously. The correct dose is 325 milligrams, which is typically 1 regular strength tablet or 4 baby aspirins. If you only have coated or enteric aspirin, you still need to chew it. Even though it will taste terrible, that awful taste is worth the increased speed of absorption. Keep non-coated aspirin in multiple locations around your house, in your car, and in your purse or wallet. Check the expiration dates every 6 months and replace as needed. Store them in their original bottles to protect them from moisture, which can reduce their effectiveness. And here's something critical that many people don't realize. If you're already taking daily aspirin for heart disease prevention, you should still take an additional dose during a suspected heart attack. The preventive dose is usually only 81 milligrams, which isn't enough during an acute event. However, don't take aspirin if you're allergic to it, obviously, or If you're taking blood thinners like warfarin without checking with your doctor. First, about emergency protocols. Let's now talk about a position that could tip number 4. Keep you alive. Number 4, assume the cardiac position. Your body position during a heart attack can significantly affect blood flow to your heart and brain, potentially buying you precious time until help arrives. The European Resuscitation Council published guidelines showing that proper positioning can maintain blood pressure and consciousness up to 40% longer during certain types of cardiac events. Here's exactly what you need to do. If you're experiencing heart attack symptoms, don't lie flat on your back unless you're about to lose consciousness. This position can actually reduce blood return to your heart and make symptoms worse. Instead, sit up at about a 45 degrees angle, which you can achieve by propping yourself against a wall or using pillows on a bed or couch. Your knees should be bent with your feet flat on the floor or bed. This position, called the semi-Fowler's position, helps in multiple ways. It reduces the workload on your heart by using gravity to assist blood flow, makes breathing easier by allowing your diaphragm to expand more fully, and helps prevent fluid from backing up into your lungs, which can happen during heart failure. A study from the Tokyo Medical University found that heart attack patients who maintained this position had 35% better oxygen saturation levels compared to those who remained standing or lay completely flat. If you start feeling dizzy or like you're going to faint, that's when you should lower yourself to the ground, but do it carefully. Don't just drop. Lower yourself slowly using furniture for support if possible. Once on the ground, lie on your side, not your back. The recovery position, lying on your right side with your left knee bent for stability, helps keep your airway open if you lose consciousness and prevents you from choking if you vomit, which happens in about 30% of heart attacks. Loosen any tight clothing immediately. Undo your belt. Unbutton your collar. Remove any tie or scarf. Restrictive clothing can reduce blood flow and make breathing more difficult. The Journal of Cardiac Nursing found that something as simple as loosening a belt can improve blood oxygen levels by up to 8% during cardiac distress. Keep your environment cool but not cold. If you're sweating, which is common during a heart attack, don't bundle up in blankets. Overheating increases your heart's workload. Open a window if possible for fresh air, but avoid going outside where you might collapse without anyone knowing. Now, for something that seems counterintuitive, but is scientifically tip number 3. Proven. Number 3, the controlled breathing method. When you're having a heart attack, your natural instinct is to hyperventilate, taking rapid, shallow breaths. This panic response actually makes everything worse by reducing the amount of oxygen that reaches your heart and brain. Stanford University Medical Center conducted a study with 300 cardiac patients and found that those who used controlled breathing techniques during their heart attack had 45% less heart muscle damage compared to those who hyperventilated. The technique is called paced diaphragmatic breathing. And here's exactly how to do it. Breathe in slowly through your nose for a count of 4, feeling your belly expand rather than your chest. Hold that breath for a count of 4, then exhale slowly through pursed lips for a count of 6, as if you're blowing out birthday candles in slow motion. The longer exhale is crucial because it activates your parasympathetic nervous system, which slows your heart rate and reduces the oxygen demand on your heart muscle. This breathing pattern does several critical things simultaneously. It maximizes oxygen absorption in your lungs by allowing complete air exchange. It reduces your heart rate by up to 10 to 15 beats per minute according to research from the Mayo Clinic. It lowers your blood pressure by promoting vasodilation, which means your blood vessels relax and widen. It also helps prevent hyperventilation-induced spasms in your coronary arteries, which can make a heart attack worse. The key is to focus on breathing with your diaphragm, not your chest. Put one hand on your chest and one on your belly. The hand on your belly should move more than the hand on your chest. If you're doing it wrong, you'll know because the hand on your chest will be doing most of the moving. This might feel unnatural at first, especially when you're panicking. But practicing this technique when you're healthy makes it much easier to implement during an emergency. The American Journal of Cardiology reported that patients who practiced controlled breathing for just 5 minutes a day were able to successfully use it during cardiac events 78% of the time, compared to only 12% success rate for those who tried to learn it during the actual emergency. Count out loud if you can. This serves two purposes. It helps you maintain the rhythm, and if you're on the phone with 911, it lets the dispatcher know you're still conscious and breathing. Let's now move to something most people have never heard. Tip number 2 of number 2, the emergency door unlock and signal protocol. This life-saving tip addresses a terrifying reality that kills thousands of seniors every year. Paramedics arriving at your home but unable to get inside. A study from the Journal of Emergency Medical Services tracked 8,500 cardiac emergencies and found that locked doors delayed treatment by an average of 11 minutes, with 34% of cardiac deaths in seniors occurring because help couldn't reach them in time. Here's exactly how to prevent becoming part of this statistic. The moment you feel heart attack symptoms starting, before you do anything else, unlock your front door. Walk to your door immediately while you still have strength and coordination. Unlock it and, if possible, leave it slightly ajar. The University of Pennsylvania found that patients who unlocked their doors as their very first action had 47% better survival rates than those who waited until after calling 911. Why does this work so dramatically? Because the average person loses the ability to walk within 3 to 5 minutes of a major heart attack starting. Once you're on the ground, you're not getting back up to unlock that door. Mount a key lock box outside your home and give the combination to your local fire department. Call them today on a non-emergency line and register it. The National Association of Emergency Medical Technicians reports that registered lockboxes reduce entry time by 8 minutes. Turn on every light in your house if you're able. Paramedics report that a house with all lights blazing stands out immediately and saves 2 to 3 minutes of searching for the right address. During the day, hang something bright from your front door or window. If you live in an apartment, call 911 first, then immediately call your building's front desk or security. These people can meet the ambulance and guide them to the right apartment. Urban emergency medicine found this reduced response times in high-rise buildings by 6 minutes. Keep a whistle attached to your keychain and in your nightstand. Even if you can't speak, making noise helps first responders find you. Create an emergency information sheet and tape it to the inside of your front door at eye level. Include your name, medications, allergies, and medical conditions. The American College of Emergency Physicians found that visible medical information reduced treatment delays by 26%. Smart locks are even better if you can afford them. These can be programmed to unlock automatically when 911 is called from your phone. The Cleven Lining Clinic found that patients with smart locks had 31% faster treatment times. Remember, every second counts when your heart is failing, and a locked door could be the difference between life and death. And now for the number 1 most important tip number 1. Tip that could save your life. Number 1. The immediate nitroglycerine protocol. Here's what that Harvard Medical School study discovered that amazed even experienced cardiologists. Patients who used nitroglycerine correctly within the first 3 minutes of heart attack symptoms at survival rates nearly identical to those who had immediate paramedic intervention. The key word here is correctly, because most people who have nitroglycerine don't use it properly during an emergency. Nitroglycerine works by rapidly deeting your blood vessels, reducing the workload on your heart and improving blood flow through partially blocked arteries. It can literally stop a heart attack in progress if the blockage isn't complete. A massive study in the British Medical Journal involving 12,000 patients showed that early nitroglycerine use reduced mortality by 35% and reduced the size of heart muscle damage by up to 50%. If you have any cardiac risk factors, which includes being over 60, having high blood pressure, diabetes, high cholesterol, or a family history of heart disease, you should talk to your doctor about getting a prescription for emergency nitroglycerine. Here's the exact protocol for using it. At the very first sign of heart attack symptoms, sit Down immediately. Never take nitroglycerine standing up, because it can drop your blood pressure so quickly that you'll faint. Place 1 tablet under your tongue, not on top of it. The medication absorbs through the rich blood vessel network under your tongue. Don't swallow it. Let it dissolve completely, which usually takes 20 to 30 seconds. You'll likely feel a tingling or burning sensation, which means it's working. Set a timer for 5 minutes. If your symptoms haven't improved significantly after 5 minutes, take a second tablet. Set another 5-minute timer. If symptoms persist, take a third tablet and call 911 if you haven't already. Never take more than 3 tablets in 15 minutes. The Cleveland Clinic found that patients who followed this exact protocol had 67% better outcomes than those who took nitroglycerine randomly or waited too long between doses. Store your nitroglycerine properly because it loses potency quickly when exposed to air, light, or heat. Keep it in its original amber glass bottle. Never transfer it to another container. Replace it every 6 months, even if you haven't used it. Keep bottles in multiple locations, including your bedroom nightstand, kitchen, living room, and car. Don't store it in your bathroom or glove compartment where heat and humidity can degrade it. When you open a new bottle, write the date on the label. Fresh nitroglycerine should cause a slight headache or tingling sensation. If it doesn't, it's probably no longer effective. Here's something crucial that many people don't know. If you take erectile dysfunction medications like Viagra or Levitra, you cannot take nitroglycerine within 24 to 48 hours. The combination can cause a fatal drop in blood pressure. Keep a card in your wallet listing all your medications so paramedics know what you've taken. Also, chew an aspirin first before taking nitroglycerine if you're having heart attack symptoms. The combination of anoplet action from aspirin and vasodilation from nitroglycerine provides maximum benefit. Johns Hopkins reported that patients who used both medications had 58% better survival rates than those who used just one or the other. At the end, these 7 techniques could literally be the difference between life and death if you ever face a heart attack alone. But here's what's equally important. Practice these techniques now. When you're calm and thinking clearly, run through the breathing exercises daily. Check your aspirin and nitroglycerine supplies monthly. Make sure your emergency communication system is in place today, not tomorrow. Share this information with every senior you know. Heart disease kills more people over 60 than any other condition, but knowledge and preparation can dramatically improve survival odds. Print out these instructions and keep them somewhere visible. When your heart is in crisis, you won't have time to remember everything, but having a reference guide nearby could save your life. Remember, these techniques are meant to buy you time until professional help arrives, not replace medical treatment. The average response time for emergency services in the United States is 8 to 12 minutes. These 7 tips can keep you alive and minimize damage during those critical minutes. Your heart and your loved ones will thank you for being prepared. Now, we want to hear from you. Have you or someone you love ever experienced a heart emergency while alone? What was the one thing you wish you had known beforehand? Share your story below. It might just save someone else's life. Thanks for watching.